Welcome back to the Doctor is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. And I am so delighted, pleased, and honored to introduce you to my next guest. We joke back east in Burlington, Vermont, this is the real Dr. Morwood, my sister herself, Dr. Betty Jo Morwood, psychiatrist in Burlington, Vermont. Dr. Morwood, Betty Jo, thank you very much for being on my television program.
Thank you very much, David, for inviting me and allowing me to speak to all the people watching who are interested in health and improving their health and getting more knowledge about general topics in health. So I very much appreciate that. Thank you.
Well, my sister, Betty Jo, it's an honor, as I said. You're a psychiatrist in Burlington, Vermont.
Yes.
Why don't we summarize briefly for our viewing audience what the training period is like to become a psychiatrist, to become board certified, and also let's briefly outline the difference between a psychiatrist and a psychologist and perhaps a counselor, marriage and family counselor, etc. So first of all, let's start with the training period to become a psychiatrist. Of course, after high school, it's 4 years of college.
Yes.
And then
4 years of medical school. So the primary main difference between the various therapists and counselors that you mentioned is that psychiatrists are physicians. They're doctors first. Then they have a specialty interest and experience and training in a special area of child, adolescent, adult development, psychological development, their emotional maturity and expressions.
So, Betty Jo, shall I call you Dr. Morwood or shall I call you Betty?
You can call me Betty Jo is fine.
Okay, thank you. So, 4 years of high school, of course. Then we have 4 years of college, 4 years of medical school. And then do you do an internship? Is there a residency in psychiatry?
There is. When I was going through the training program, it was year of postgraduate training. So my first 2 years of postgraduate training in psychiatry were in Albany, New York. Then I transferred and finished my residency, which is a specialty training in psychiatry at Stanford. Then I went back to Vermont and did a 2-year fellowship in child psychiatry. So there's first the medical and neurologic training, and then there's the specialty, things having to do more with specific diagnoses or illnesses that we would probably see.
Okay, so after medical school, which was 4 years,
Yes.
you did a total of an additional 6 years of residency and fellowship training.
5 years.
5 years.
I
So
did 5 years.
5 years after medical school, internship and residency training
Yes.
program.
And I should also mention that it's in some states it's mandatory, and in other states it's on your honor system to continue your medical education every year to get at least 10 credits in ongoing medical education.
Right, we call those CMEs or continuing medical education credits. Okay.
Yes.
So Betty Jo, Dr. Morwood, what I'd like to talk about for this first segment of about 18 minutes remaining is this concept or diagnosis of depression. Everybody gets the blues every once in a while. We all have challenges in our life and difficulties during our life where we feel kind of down or low energy. But when does that feeling of being sad or having the blues, when does that cross over into a diagnosis of depression? And perhaps we can teach the audience actually what the definition of depression actually is.
Depression, people use the term, oh, I'm so depressed today, or I'm depressed because my cat did something wrong. But depression as a medical term is it's a real illness that pervades your physical self, impacts your social, your work ability, even affects your ability to learn and your memory. So depression is a biochemical shift in your health. So, and the other part of the question is, when should you seek medical help? When it's lasted at least 2 weeks, and or earlier, right away, if the depression is impacting your ability to function, or you're feeling like life isn't worth living, and you're having suicidal thoughts or impulses, then you seek help immediately.
Well, Betty, are there diagnostic criteria? In other words, a lot of people say, well, I've been depressed for a week, or I've had the blues for a week, or I lost my dog, or I lost my job, or you've suffered a significant loss in your life of a loved one, and you've been down. People have this expression, I've been down for a week. So what are the specific diagnostic criteria to say someone is, can you say
Clinically
clinically
depressed,
depressed? Well,
yes.
what does that mean, to be clinically depressed?
To be well, it's different than grief or normal average sadness in reaction to, say, a job loss or a social, like a relationship breakup. That's average. That's human beings, how they respond to life events. A depression, first of all, it is a sad mood that is unremitting. It just goes on and on. If you lose your ability to find pleasure in anything, like the whole, it's like all the colors are faded away, and the whole world seems gray and lifeless. Even taste changes, that the taste of food no longer pleases you. People sometimes gain weight when they get depressed, and sometimes they lose weight. So it does affect your metabolism and your craving or appetite for food. There's a sleep disturbance that goes along with depression. Classically, it's early morning wakening, so that if your usual time to wake up is between 5 and 6, you may find yourself just wide awake at 3 o'clock in the morning and unable to return to sleep. So that certainly impacts your health and ability to function in the rest of the day if you are constantly sleep deprived. So, and what I said, how the way your cognitive or your thinking part of your brain functions is affected by depression is that you lose perspective. You lose the ability to say, well, tomorrow's going to be a better day. You just feel like your world narrows, so that all you're feeling is the sadness and pain, that nothing else is real. So people could say, oh, but look at the beautiful flower. It's meaningless to someone who is truly clinically depressed.
Well, Betty Jo, when we talk about clinical depression and some of the symptoms you're describing actually being somatic or physical. It's not just emotional, mental.
No, it affects your physical health.
So there may be a disagreement, but is the cause of depression, is that a biochemical, physical, or brain etiology or cause, or is it just caused by the psyche or emotions? Like what? That's
a profound and important question, David, and people are researching this all the time. That in the days before we had ways to image the brain's actual function, the MRIs, the magnetic resonance, or even EEG, the electroencephalogram. Before we had any ways to measure brain activity, the theory was that depression was caused by a loss. Could be a loss, something that was for your self-esteem, or something that affected your feeling of security or safety in the world. Now, certainly grief, which is a profound loss, can trigger depression. Sometimes people, even a seasonal shift can cause depression. Or sometimes it's, like somebody maturing, going from a child to adolescent, that their body is changing, and that can change the chemical balance of their body. So that can trigger depression.
Okay, so Betty Jo, I think one of the most important things that we can do in this segment of 18 or 19 minutes is to convey to the audience who should and when should someone call for help. For example, if someone has a significant loss, that they lose their job, or they have a financial loss, calamity, or they have a loss of a relationship, loss of a spouse, a loved one, that it's normal, natural to feel down, or what we call, I feel depressed after this loss.
Absolutely.
But does that mean that they need or could benefit from a psychiatrist? I guess there must be some additional criteria other than just sort of feeling depressed.
When somebody feels down or sad, everybody is different in the way they heal themselves. Some people need time alone to think through things and to sift out the things that are important to them. Some people do need to reach out. It's not necessarily a psychiatrist, but to reach out to a friend or close family member, someone to share and maybe give that perspective to the person. And maybe even some helpful suggestions on what they could do or should do to get themselves out of that sad mood. Again, if there is any thought of suicide, absolutely seek help, seek professional help, whether that's a counselor, a psychologist, or a psychiatrist. That you do not. That's the only problem that there's no solution for. So that's the flag to go get help.
If someone feels like they're
suicidal,
suicidal.
that is absolute black and white. That's
Okay.
seek help.
Okay. Now, of course, Betty Jo, we could talk about this for hours, and I find this fascinating. But everybody has, like, if you tell your friends, oh, I'm kind of depressed or down, everybody sort of has an at-home remedy. Oh, you should take up jogging. You should work out. You should listen to your favorite recordings, your favorite Beatles records. You should go to the movies. You should go out with some friends. But do those things actually work or help? Or
when somebody has a mild, say, case of the blues, or has fallen into a rut, yes, of course, distraction or going to see a comedy at the movie theater, anything like that will help. I'll quote to you one of my patients who says, "My friends tell me to just go to the gym and work out. That would make me feel better." She said, "I can't even move my foot." That the loss of energy, the lack of motivation or will, however will or willpower is defined, that makes it difficult, if not impossible, for someone to do the things that, it's common sense. Yeah, they would feel better if they did. They can't bring themselves to do it.
Okay, so in listening to you, I've heard a few specific criteria. A lot of it related to the physical symptoms.
Yes.
Not just feeling down, but a loss of energy, a loss of appetite perhaps, or maybe increased appetite. A change in appetite,
Yep.
even change in the way food tastes, change in sleep patterns, change in the way that you perceive the world, and even your thinking, how your cognition is.
Yes, like a student may find their grades slipping, or someone who isn't a student will find it harder to maintain lists of chores that they have. People are optimists and some people are pessimists. It's personality. It's not an illness. It's not a disorder. It's not a disease. When somebody, again, is worried so that they, like, of course, like you want to plan for a trip. Let me give you an example. You want to plan for a trip. There is, some forethought needed and some maybe rehearsal or plans or arrangements. But if you can't get beyond, well, what if the train is late? What can I do if, my baggage is lost? That you can never enjoy the anticipation of the trip. You can't have any pleasure in your life. That the worries or the rehearsing negative future events takes away your ability to live your life now, to enjoy your life as it is.
Okay, so Betty Jo, for example, let's say the college student has a big quarter term exam coming up or final exam, and that college student, man or woman, boy or girl, feels that much of their academic success it relies upon them passing that exam. So
Yes.
can we say that it might be normal for them to have some insomnia, or they might toss and turn at night, or have their sleep patterns interrupted? I mean, if you have something legitimate, like if you're feeling what we might consider legitimate pressure, if you're trying to refinance a mortgage, or you have a big final exam coming up, or we might have a big work assignment and there's a lot of pressure. A young attorney or an engineer has to submit a project, and they might experience some insomnia, or they might have a change in appetite and eat a lot or eat less and lose weight. Now, does that cross into what you might consider an anxiety disorder?
If it goes on for too long, if you're anxious about, like your example of the college student, if the fear of failure or anticipating being kicked out of college can spur them, can motivate them to study and be thorough and not goof off, that is healthy. That's healthy anxiety. When it becomes a disorder is people who, and I mean this is real, that people who are afraid they can't ever learn it well enough. So they'll go over and over and over and over. They cannot accept any imperfection in their learning. Or people who, at a final exam, they spend so much time on question number one, they don't go on. They don't finish the rest of the exam. That's crippling anxiety. That is certainly an anxiety disorder.
Okay, so let's say that someone comes to see you and they seem to have some symptoms, and they describe behavior or thought patterns where they're stuck in kind of these negative thoughts or anxiety disorder and anxiety patterns. What can be done about that? Is there medicine? Is there talk therapy? Do counselors take care of that? Do you tell someone, hey, you need to walk by the beach every day, or you should go work out or take up a musical instrument? So what do we do? What does the psychiatrist do about someone with an anxiety disorder?
First of all, there has to be an evaluation of the person's symptoms and the severity of those symptoms and how much those problems are impacting their life and not allowing them to get on with their life. So there's the evaluation, like how many symptoms do they have? How severe is each of those symptoms? Based on that, sometimes it would be some advice about walking on the beach, or in general getting more exercise or eating fresh food rather than processed food. And again, when somebody is able to break out of their circular thoughts or their fears, if they're afraid to go out of the house, it's not going to do them much good to suggest they go to a gym. So if they can follow through with that's the advice, and that's all they need. Sometimes they need more professional counseling. The counseling that is, will assign homework, will have you rank your level of fear when it approaches, like, say, can you can you walk down the hall and look at an elevator? Or can you walk up to the elevator and push the button? So it gives you assignments step by step to overcome fears that are paralyzing you. And yes, there are medications. Most people will think that, well, if you're anxious, you should be given a tranquilizer or a sedative. That seems like common sense, but that is way not the first choice. The first choice in if you're going to, if you evaluate and the person needs a medication to treat anxiety, the first choice is an antidepressant, a stimulant, something that brings you up. And then you're saying, well, the person is nervous, they should have something to calm them down. But with a antidepressant, the hope for effect is that it will encourage and elevate your own mental energy to be able to say, well, I'm not going to deal with that unless it happens. Or, no, that's ridiculous. Spiders can't hurt me. Or nothing, I'm strong enough to deal with any things that come my way.
Okay. Betty Jo, I have maybe it's a related question, it may be indirect or maybe direct, but what about what people call panic attacks, where people say, seemingly for no specific reason, they will suddenly feel anxious and their heart beats more rapidly and they might get sweaty and they have a pounding pulse. Mm-hmm. And some people experience these sort of somatic symptoms in their body that all of a sudden, for no apparent reason, they feel panic. Is that part of an anxiety disorder, or is that totally separate?
No, that is an anxiety disorder. Someone can have generalized anxiety where they're, like you say, a worry war, always worried about things, and have panic attacks. The panic attacks people really suffer when they have panic attacks because they can occur anywhere, in a grocery store, while you're driving, at school, and it's you may be able to say, I'm not dying, I'm not going to pass out, I can breathe, but somebody described it as, okay, if you're standing on railroad tracks and you're seeing a locomotive come towards you, to say it's just a panic attack. It's the feelings are real, and people are feeling it's hard to get a breath, and their hands start tingling and their face goes numb, and their heart, they start sweating, or they feel like they're going to vomit or lose control of their bowels. It's a very intense, painful experience for people.
Okay, so Betty Jo, this is fascinating to me. I wish we could talk about this stuff for hours. We have about a minute left. Now, yes. What about the person? Well, many people say, I can't wait to get home to have a scotch, mm-hmm. or I want to meet the girls or the guys at the local neighborhood bar. Everybody has a glass of wine or a cold beer, mm-hmm. or, everybody has a way of sort of unwinding. Go to the gym or practice music. Now, that sounds to me like a very functional activity to do, I think. Now, that doesn't mean that a person has an anxiety disorder if they can't wait to finish their work and meet their buddies at the local bar for a beer, right? Or maybe it does. I don't.
Well, when you say can't wait, most people, look forward to the bell or the 5 o'clock buzzer or whatever to think, okay, your work is over, now it's time to relax. That's normal. But if you keep thinking about, I want a beer, I want a scotch all day, that's you've got a problem. And to use alcohol as a slow, easy way to socially lubricate you and your friends, or to help you relax, that's healthy. That's what it's supposed to do. That's the real use of alcohol. But to drink any kind of alcohol quickly so that it overwhelms your ability to process it. So your brain is almost getting poisoned from the alcohol, and you can't maintain your balance, and that's bad. That's not good for your health. That's not good for anything or anybody.
Well, Dr. Morwood, Betty
Yes.
Jo, my sister, it's been great to have you as a guest. I've learned a lot, and I'm sure our viewing audience has found this helpful. Thank you very much.
Well, thank you.
Next
it's been
time,
a pleasure, an honor.
Next time you come to California, I want you to be my guest again, please.
Will do. Just ask me.
Betty Jo
Thank
Morwood,
you.
psychiatrist in Burlington, Vermont. My sister, the real Dr. Morwood. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. And this is the television show The Doctor Is In. We're now going to take a very brief pause for a very good cause. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. One of the common goals I share with my patients is that they look natural after their facial rejuvenation.
Dr. Morwood made me feel really comfortable. His staff is phenomenal. Going into his office is always a great experience.
Call or click today to learn how our combined approach of art and science can enhance your natural beauty. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. A smooth, firm neckline is a universal sign of beauty in both women and men.
Dr. Morwood not only helped me regain my confidence, he helped me achieve the best version of me.
Call or click today to learn how the natural neck lift can rejuvenate your beautiful neck and jawline. Welcome back to the Doctor Is In television program. I am Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much for being with us today. During this next segment, I'd like to talk about one of my most commonly requested procedures in my practice, in my office here in Monterey, California, and that is the natural neck lift. The natural neck lift is a system. It's a system of careful analysis looking at your anatomy, your appearance, and your goals to develop a custom designed approach just for you. I think it's very important to emphasize that in my practice, and that is the same as in many high-quality board-certified plastic surgeons' offices, we like to offer a custom-designed approach. This is not the type of practice, it's not the type of procedure where you get in line. You can read about these places where you go, you get in line, and everybody gets the same operation or the same procedure or the same type of laser or same treatment. This is truly a custom-designed approach for men and women. Again, a careful analysis based on your own anatomy, your appearance, and your goals to develop a custom-designed approach just for you. I think it's important to emphasize that a clean, crisp, well-defined, firm neckline, jawline, and chin in both men and women really serves as a very valuable foundation for a beautiful face, for your entire presentation. And of course, the face is a very important, very powerful social tool. And how you feel about your presentation, how